Good morning, students. Just wanted to start off the day by saying you only have 57 days left until you graduate. Is that not an awesome feeling? Well, let's ride that awesome wave and let's get into a discussion here on data, information management, safe healthcare, and why you are an integral part of all of this. Okay? So, you've heard data, we've talked about data, you've read about data, but do we really understand what data is for us? So, really, what is data? Data is constructed into what we call data sets. And data sets are built from every patient interaction. So think about that. Every time you've done something for your patient, or your patient has told you something, you're gathering data, right? We're gathering information for our patients. So then, how do we get these data sets? Well, a data set, like I said, is a collection of all these little data points. We take them, we store the data, we gather the data, obviously, right? We see what's trackable in the data. And it helps research, it helps improve patient outcomes, and we're able to track all the different data points of interactions that we've had with our patients. So the electronic health record collects all patient data into a central database, right? So think about that. What happened when you were first hitting the floor as a freshman nurse? Now that you're seniors, think back to that day. I know it seems like forever ago. It was 4 years, 3.5 years ago. But think about all the data that we had you collect. And everyone wanted to say, well, no, this isn't really important, right? All those vital signs, the temperatures, making sure everything is accurate. Because what happens if it's not accurate? Well, we don't have accurate data, and we're going to have an improper analysis, or we could have some false information there, right? So the electronic health record is our centralized database that allows for analysis of data. It allows for the interpretation of different trends from the data, helps us extrapolate all this information, and kind of drive the practice into a safe way. And it improves patient safety, especially. It's able to connect with providers. So many of you are too young to remember the days of paper charting. Some of the nurses you may run into that are a little more seasoned will say, well, those were the days I miss. I could do paper charting. It wasn't so bad because now I have to document about my documentation. Well, there's a reason for that. We need that data, right? We need it in real time. And with paper charting, we weren't able to see a whole picture. So think about a patient that came to the ED. We won't have a full set of data or information to help guide our treatment plan, right? We're not sure if they're allergic to something, like maybe they're allergic to an antibiotic, but their chart is paper. The provider is going to order something, the patient may be unconscious and no one's there, and we have an allergic reaction. Well, the beauty of the data availability now in today's world with the electronic health record allows us to see their records, right? See all their primary care information. If they ever been in the hospital before, what do they need? So that's the importance of collecting all this data and making these data sets and looking at trends for our patients. So some of the data, what data and for who, right? Well, we're looking at patient data, right? That's our prime key player here. So let's look at what a patient data set may consist of. So I think I alluded to a little bit at the beginning here, right? We've had vital signs, Foleys, if they had a Foley, if they haven't had a Foley. Do they need a Foley? What kind of IV access do they have? How long has it been there? What laboratory results have their laboratory tests have they had to look at results? What procedures have they had currently or in the past? What medications are they on? What medications can't they be on? What are their allergies, right? So all these different data points our our information. It's information that we use to improve patient outcomes. Looking at hospitalizations and procedures and medications there, the primary care doctor takes all that information and helps build a plan for the patient to grow, right? So here's the players that are all involved, okay? So obviously patient safety is data driven. So the primary care providers are key, the hospital providers, but not just the providers, right? The nurses. The nurses are the ones, we are the ones that are out there on the front lines at the bedside with the patient. We're going to catch these mistakes that the providers put in, right? We're going to see an order come across and say, something's just not right. You know, the hospital providers, like I said, there's the residents, there's the PAs, all the nurses, PT, OT, social work, pharmacy, the insurance company, all these different agencies, all these different players to make sure the care that we are delivering to our patients is appropriate, is safe, and is, well, in at least the insurance world, you know, necessary, medically necessary. That is the biggest driving force, right? Is money. So using this data to help lower infection rates, like with CAUTIs or pressure ulcers. So these are the players that are tied to this data and will utilize all the data just like we do as nurses. So a brief little history of the EHR. It was actually mandated starting in 2010. There was some funding available for hospitals and practices from the Centers for Medicaid and Medicare to begin implementing this electronic health record. There's many different options out there. You know, we've used eRecord and we've used CareConnect and Your Time with Us, but there's other ones out there. It was designed as an interoperable, interdisciplinary collaboration, right? So in our town, we have the RIO, which connects the different healthcare systems, so we can tie all our data together, right? So it doesn't matter if I say go to Rochester General, my information from Strong can be pulled over, or if I go to Unity and my doctor's with U of R, all my data can get pulled over because of the electronics. All these data points that my doctor has been working on can apply and improve my outcomes in the hospital, improve my safety in the hospital. So the Centers for Medicare and Medicaid have mandated that everyone by 2021 is moved to the electronic records. So really it's a 10-year window that has shown some great improvements because of all the data that we can collect now. So like I was saying, research, right? Research is data driven. So research really is born out of data and seeing a trend of something happening, something that's not going the way it should. So the nurse or the researcher, or whoever, can say, okay, I'm going to take this data set and I'm going to expand upon it. I'm going to see why. So, for instance, the CAUTIs and pressure ulcers, and these numbers, not necessarily accurate, but it does show a generalized trend, okay? So, over time, as time has progressed with all the data that we've been able to obtain and research that has been driven by the data that has been obtained since having an electronic means of collecting and centralizing all of our data and analyzing all our data, has shown that CAUTIs, or the catheter-associated UTIs, have started to decrease. Pressure ulcers were decreasing because we're turning positioning based on research from all of our data that showed that patients were just laying in one spot and were creating these pressure ulcers, or increased antibiotic use because of an extended length of time a Foley was in place. So, the collaboration that has come, nurses now have taken the CAUTI data and have really started being an advocate for the patient to get the Foleys out. There's new devices that are out there because of all this data that we've had. It shows these nursing researchers have improved patient outcomes and created evidence-based care for us, reducing incidences of these terrible patient outcomes and turning them around. And it was just from simple statistical analysis to help make this change. So really, ultimately, it's about the patient, right? The patient is the one that we want the best outcomes for. So how do we do that? Well, our patient care is evidence-based practice. What got us to evidence-based practice? Well, it's data. Our data gets centralized and can be extrapolated to the CDC and to different oversight agencies and governing bodies, and they can take this very non-personal data, age, sex, what their disease process is, but have no way to tie it back to a patient specifically through the electronic, almost electronic jungle where all this data sits, right? We can pull out certain data and look at these greater trends. And the people that do this and calibrate and compile this data, such as like an epidemiologist, right? They're the ones who look at vital statistics. They look at trends of infections. They analyze all this data on a grander scale, or we can just analyze it in our practice setting and begin to institute evidence-based change and evidence-based care for our patients. So the team obviously relies on all this data. Now in the middle of our screen there, that's our patient in her gown, right? And look at all the players around her that are collecting data, analyzing her data, and helping to promote her health and well-being. So it's all this data in real time. It's not anything that has to go to, a paper into a program. It's already there. It's happening as we're collecting this data. We can start analyzing and looking at trends. I mean, the outcomes have improved just related to the data, right? So we've had a decrease in CAUTIs specifically, decrease in pressure ulcers, decrease in drug and antibiotic use. The Centers for Medicaid, Medicare, they've been trying to reduce these numbers because of all the data that they were seeing. So all this data that we collect, we've been starting to implement change and seeing an increase in patient outcomes, right? A bettering for our patients. That's what we want to do. That's why data is so important. So remember, we have to protect the data, and that's why we have HIPAA, but that's a whole nother discussion. But the data that we collect can be individualized, and it can be used and extrapolated and shown these trends that can ultimately improve our patient care and our patient outcomes as nurses. We don't have to be a special statistician, a psychometrician. We can just look at the data that we collect on our patients and say, hey, wait a minute. This data is showing, we're starting to lose a trend. So as a fresh set of eyes going into the health practice, you guys are the responsible party. You guys are going to be the next generation to help. So I hope you guys have a better insight of data, and we're going to continue this discussion online. So I'm looking forward to everyone's input. Thanks so much, everyone. Have a great day.